This is Dr. Bev Knox, and you are listening to my psychology tutorials. Learn psychology while you sleep. Standards of assessment. Clinicians use different methods of assessing to arrive at a diagnosis, including interviews, psychological testing, self-reporting questionnaires, behavioral measures, and psychological measures. The role of assessment, however, goes further than classification. A careful assessment provides a wealth of information about clients' personalities and cognitive functioning. This information helps clinicians acquire a broader understanding of the formal assessment involves one or more clinical interviews with the client, leading to a diagnostic impression and a treatment plan. In some cases, more formal psychological testing probes the client's psychological problems and intellect, personality, and neuropsychology functioning. The clinical interview is the most widely used means of assessment. The interview is usually a clinician's first face-to-face contact with a client. Clinicians often begin by asking clients to describe the presenting complaint in their own words, saying something like, "Can you describe to me the problems you've been having lately?" The clinician will usually probe aspects of the presenting complaint, such as behavioral abnormalities and feelings of discomfort, the circumstances surrounding the onset of the problem, history and past episodes, and how the problem affects the client's daily functioning. The interviewer encourages the client to describe the problem in her or his own words to understand it from the client's viewpoint. Although the format may vary, most interviewers cover these topics. 1. Identifying data. This is information regarding the client's socio-demographic characteristics to include address and telephone number, marital status, age, gender, racial or ethnic characteristics, religion, employment, family composition, and so on. 2. Description of the presenting problems. How does the client perceive the problem? What troubling behaviors, thoughts, or feelings are reported? How do they affect the client's functioning? When did they begin? And 3, psychosocial history. This is information describing the client's development history to include education, social, and occupational history, early family relationships. 4. Medical and psychiatric history. Here, the clinician elicits the client's history of medical and psychiatric treatment and hospitalizations. Is the presenting problem a reoccurring episode of a previous problem? If yes, how was the problem handled in the past? Was treatment successful? Why or why not? 5. Medical problems or medication. This refers to a description of present medical problems and present treatment, including medication. The clinician is alert to ways in which medical problems may affect the presenting psychological problem. For example, drugs for certain medical conditions can affect people's moods and general levels of arousal. The interviewer is attentive to the client's nonverbal as well as verbal behavior, forming judgments about the appropriateness of the client's attire, grooming, apparent mood, ability to focus, and attention. Clinicians also judge the clarity or soundness of clients through the perceptual processes and level of orientation or awareness of themselves and their surroundings. These clinical judgments form an important part of the initial assessment of the client's mental state. In the course of the interview, the clinician may also assess the client's cognitive functioning with a mental status examination. The specifics of the examination vary, but they typically include features such as the following: their appearance, appropriateness of the client's attire and grooming, their mood, prevailing emotions displayed during the interview, their level of attention, ability to maintain focus and attend during the interviewer's questions, their perceptual and thinking processes, their ability to think clearly and discern reality from fantasy, their orientation, knowing who they are, where they are, and the present date, and their judgment, their ability to make sound life decisions in daily life. No matter what type of interview is conducted, the interviewer arrives at a diagnostic impression by compiling all of the information available from the interview, from the review of the client's background, and from the presenting problems. To review, the clinical interview involves the use of a set of questions designed to elicit relevant information from people seeking treatment. The three major types of clinical interviews are unconstructed interviews, where clinicians use their own style of questioning rather than follow a particular script, semi-structured interviews, where clinicians follow a preset outline in directing their questioning but are free to branch off in other directions, and structured interviews, where clinicians strictly follow a preset order of questions. So the methods of assessment includes the clinical interview, psychological tests, neuropsychological assessments, behavioral assessments, cognitive assessments, psychological measurement, and sociocultural factors in psychological assessments.